Have you ever noticed how some people, even after their 70s or 80s, maintain graceful and coordinated movements, while others develop that frustrating instability that makes every step a challenge? Or perhaps you've noticed subtle changes in your motor coordination, that glass that slips between your fingers for no apparent reason, the increasing difficulty buttoning a shirt, or handling cutlery during a meal, the feeling that your steps are no longer as sure as they used to be. For those over 60, these experiences are particularly disturbing, as they signal a possible loss of independence, something we all deeply fear. And if you or a family member has been diagnosed with Parkinson's, this concern with motor coordination and movement control becomes even more central to your daily life. What very few people know, even among health professionals, is that certain vitamins, yes, substances we imagine to be beneficial, can silently accelerate the decline of motor coordination and drastically worsen Parkinson's symptoms in older adults. As a neurologist specializing in movement disorders for over 30 years and a researcher dedicated to the interface between nutrition and neurological health, I've observed an alarming pattern. Well-intentioned elderly patients who, in an attempt to improve their health through vitamin supplementation, inadvertently end up consuming precisely the vitamins that worsen their coordination and balance, and, in the case of those with Parkinson's, intensify tremors and rigidity. This isn't just my clinical observation. Recent studies from the University of Oxford, the Mayo Clinic, and the Karolinska Institute have documented how certain vitamins, in specific doses or formulations, can interfere with neurological function and brain mechanisms already weakened by aging or Parkinson's. Today, I'll share with you the two vitamins that most frequently cause problems for older adults, especially those with Parkinson's. Most importantly, I'll explain exactly how they affect your nervous system, what signs indicate you may be experiencing their negative effects, and what you can do to protect your motor coordination and quality of life. These aren't obscure or rare vitamins, but widely consumed and frequently recommended substances, sometimes by doctors themselves, who are unaware of their specific effects on the elderly and Parkinson's patients. Imagine finally understanding why, despite all your efforts to maintain a healthy lifestyle, your coordination seems to deteriorate at certain times, or why your tremors and stiffness seem to intensify even when you're rigorously following your medication regimen. This information could represent a turning point in your journey with aging or Parkinson's, helping you regain control over your movements and maintain your independence for longer. Before we reveal these two problematic vitamins, I'd like to know where you're watching this video from. Leave your city in the comments and briefly tell us if you or an elderly family member has faced challenges with motor coordination or Parkinson's. Your experience may help other members of our community facing similar situations. Before we continue, I want to extend a special invitation to those of you who care about neurological health in older adults. Here on the Beyond Parkinson's channel, we share practical, evidence-based strategies weekly that have helped thousands of people maintain their mobility and independence despite the challenges of aging or Parkinson's. If you haven't yet subscribed, click the subscribe button and the bell now to receive notifications about our upcoming videos. It's completely free and can make a significant difference in your quality of life or that of your elderly family members. Now let's learn about the first vitamin that may be silently destroying your motor coordination. The first vitamin that can be surprisingly harmful to older adults, especially those with Parkinson's, is high-dose vitamin B6, also known as pyridoxine. This revelation often comes as a surprise, since vitamin B6 is often associated with neurological health and recommended for a variety of conditions, from carpal tunnel syndrome to diabetic neuropathy. The problem isn't vitamin B6 itself, which is essential for hundreds of processes in our bodies, but the high doses often found in supplements, which can exceed daily requirements by 100 times or more. Let's understand exactly how excess vitamin B6 can compromise motor coordination and worsen Parkinson's in older adults. The central mechanism involves how high doses of B6 interfere with the metabolism of neurotransmitters, the chemicals that enable communication between neurons. In normal doses, B6 is essential for the balanced production of serotonin, dopamine, GABA, and other neurotransmitters crucial for motor control. However, in high doses, an imbalance occurs in this system. Studies at the University of Toronto have shown that excess B6 can alter the ratio of different neurotransmitters, particularly affecting the brain circuits responsible for fine movement control. For older adults, whose systems are already naturally declining in neurotransmitter balance, this impact is amplified. For Parkinson's patients, the problem is even more serious. Excess B6 directly interferes with the metabolism of levodopa, the main medication used to treat the disease. Vitamin B6 accelerates the degradation of levodopa before it can cross the blood-brain barrier and be converted to dopamine in the brain. A Mayo Clinic study documented that Parkinson's patients taking supplements with more than 50 mg of B6 daily experienced up to a 50% reduction in levodopa effectiveness, resulting in significantly worsened tremors, stiffness, and coordination problems. Furthermore, excessive B6 supplementation has been associated with a specific type of sensory neuropathy, which affects the nerve pathways that transmit information about the body's position in space, a fundamental component of motor coordination. A study published in the journal Neurology followed 189 elderly individuals for 3 years and found that those who consumed more than 100 mg of supplemental B6 daily had a 300% higher risk of developing balance and coordination problems compared to those who obtained B6 only from food. Particularly alarming was the finding that these problems persisted in 30% of cases even after stopping supplementation, suggesting that some damage may be irreversible. How can you tell if you're consuming potentially harmful levels of vitamin B6? The first step is to check the labels of all supplements you take, including B complexes, multivitamins, energy or nervous system supplements, and even certain magnesium supplements, which often include B6 as an adjunct. B6 can appear as pyridoxine, pyridoxal 5-phosphate, or simply as vitamin B6. The recommended daily intake of B6 for adults over 60 is only 1.7 milligrams for men and 1.5 milligrams for women. Many supplements contain 50 milligrams, 100 milligrams, or even more per dose, far exceeding this requirement. What signs indicate that you may be experiencing the negative effects of excess B6? In addition to impaired motor coordination, symptoms such as tingling in the extremities, painful sensitivity to touch, and numbness or burning sensations, especially in the feet and hands, may indicate B6 neuropathy. For people with Parkinson's, warning signs include unexpected reductions in the duration of medication effect, more frequent and intense off periods, or increased tremors and rigidity without apparent cause. If you suspect you may be consuming too much B6, do not abruptly stop supplementation, as this can cause deficiency symptoms. Instead, consult your doctor about gradually reducing the dose to safe levels. For most older adults, including those with Parkinson's, getting B6 through a balanced diet is sufficient and much safer than supplementation. Foods naturally rich in B6 include poultry, fish, whole grains, potatoes, chickpeas, and bananas, which provide the vitamin in forms and amounts the body can adequately process. The second vitamin that poses significant risks to motor coordination in the elderly and can dramatically worsen Parkinson's symptoms is preformed vitamin A, also known as retinol, when consumed in high doses through supplementation. Again, we're talking about a vitamin essential for health, including proper neurological function, which becomes problematic when ingested in excessive amounts, especially by people over 60. Let's understand how excess vitamin A compromises motor coordination and worsens Parkinson's. The central mechanism involves how excess retinol affects both the peripheral and central nervous systems. Preformed vitamin A in high levels can accumulate in nervous tissue, causing oxidative damage to the myelin sheaths, the protective covering of nerves that allows proper conduction of nerve impulses. This damage compromises the speed and accuracy of neural signal transmission, directly affecting movement coordination. A study from Uppsala University in Sweden documented that elderly individuals with serum retinol levels in the upper quartile of the distribution had a 42% faster deterioration in fine motor function over 5 years compared to those with levels in the middle range. For Parkinson's patients, the problem is even more complex and worrying. Research from the Karolinska Institute has shown that excess vitamin A can interfere with dopaminergic signaling in the brain, potentially exacerbating the dopamine deficit that characterizes the disease. Furthermore, high retinol levels can increase oxidative stress in brain regions already affected by Parkinson's. accelerating the death of remaining dopaminergic neurons. A particularly relevant aspect for older adults with or without Parkinson's is that excess vitamin A can contribute to osteoporosis, weakening bones, and increasing the risk of fractures during falls, which in turn become more frequent due to coordination problems induced by vitamin A itself. This vicious cycle is especially dangerous for older adults, for whom a hip fracture can represent a point of no return in terms of mobility and independence. Furthermore, excessive vitamin A supplementation has been associated with an increase in intracranial pressure, which can manifest as dizziness, vertigo, and imbalance, further compromising stability and coordination. A study published in the journal Movement Disorders followed 267 Parkinson's patients for 4 years and found that those who consumed supplements containing more than 5,000 IU daily of preformed vitamin A had a 29% faster progression of motor symptoms compared to those who obtain vitamin A primarily through beta-carotene from dietary sources. How do you know if you're consuming potentially harmful levels of vitamin A? The first step is to check the labels of all the supplements you take, including multivitamins, vision or skin supplements, and even certain fortified fish oils, which often contain added vitamin A. Vitamin A may appear as retinol, retinol acetate, retinol palmitate, or simply as preformed vitamin A. It's crucial to differentiate between preformed vitamin A and carotenoids like beta-carotene, which the body converts into vitamin A only when needed and poses no toxicity risks. The recommended daily intake of vitamin A for adults over 60 is 900 mcg, 3,000 IU for men, and 700 mcg, 2,333 IU for women. Many supplements contain 5,000 IU, 10,000 IU, or even more per dose, dangerously approaching levels associated with chronic toxicity. What are the signs that you may be experiencing the negative effects of too much vitamin A? In addition to deteriorating motor coordination, symptoms such as dry, scaly skin, joint pain, persistent headaches, blurred vision, and chronic fatigue may indicate hypervitaminosis A. For people with Parkinson's, warning signs include an unexplained acceleration in the progression of symptoms, especially tremors, rigidity, and balance difficulties, without adequate response to medication adjustments. If you suspect you may be consuming too much vitamin A, consult your doctor before making any changes. Reduction in supplementation should be gradual and monitored, as vitamin A is fat-soluble and remains in the body for long periods. For most older adults, including those with Parkinson's, obtaining vitamin A through a balanced diet rich in colorful vegetables is sufficient and much safer than retinol supplementation. Foods such as carrots, sweet potatoes, spinach, pumpkin, and papaya provide beta-carotene, which the body converts to vitamin A only in the amounts needed, naturally preventing excess accumulation. Before we continue, I want to pause to clarify something important. This video does not suggest that all vitamins are harmful for the elderly or people with Parkinson's. On the contrary, adequate nutrition, including adequate vitamin and mineral intake, is crucial for neurological health, especially in old age. What we're addressing are specific situations where oversupplementation of certain vitamins can cause more harm than good. Have you noticed any correlation between the vitamin supplements you take and changes in your coordination, balance, or, if you have Parkinson's, the severity of your symptoms? This question isn't just out of curiosity. Many elderly people and Parkinson's patients live for years without realizing that something in their supplement routine may be silently contributing to problems they mistakenly attribute solely to age or the natural progression of the disease. Share your experience in the comments below. You can simply describe which supplements you take regularly and whether you've noticed any changes, positive or negative, in your motor coordination. Your comment may be exactly the insight someone else needs to identify a similar pattern in their own life. Additionally, your feedback helps us create content more relevant to the real challenges our community faces. Now, let's explore some safer alternatives to oversupplementation and discuss strategies for protecting your motor coordination. while still ensuring adequate nutrition. For older adults and people with Parkinson's disease seeking to maintain or improve their motor coordination, there are much safer and more effective alternatives than supplementing with high doses of vitamins B6 and A. Let's explore some evidence-based strategies that can make a significant difference in your quality of life. First, instead of isolated vitamin supplements, consider adopting a complete eating pattern that naturally provides a balanced spectrum of nutrients. The Mediterranean diet, rich in olive oil, fish, fruits, vegetables, nuts, and whole grains, has been consistently associated with better neurological function in older adults and slower progression of Parkinson's disease. A study from the University of Navarra in Spain followed 8,000 people for 12 years and found that those who faithfully followed the Mediterranean diet had a 46% lower risk of age-related coordination problems compared to those who followed typical Western eating patterns. To obtain vitamin B6 safely, prioritize foods such as chicken breast, chickpeas, salmon, potatoes, bananas, and pistachios, which provide the vitamin in its natural form and in amounts that the body processes adequately, without the risk of excess accumulation. For healthy vitamin A, regularly consume orange and dark green vegetables, such as carrots, squash, sweet potatoes, spinach, and kale, rich in beta-carotene, which the body converts into vitamin A only in the necessary amounts. Second strategy, if supplementation is necessary due to deficiencies confirmed by laboratory tests, opt for multivitamins formulated specifically for people over 60, which generally contain more appropriate doses and more easily utilized forms of nutrients for the aging body. Ideally, choose products that contain less than 10 milligrams of vitamin B6 and that obtain their vitamin A primarily from beta-carotene, not preformed retinol. Always consult your doctor before starting any supplementation, especially if you have Parkinson's, as drug interactions are complex and individualized. Third strategy, incorporate regular coordination exercises into your daily routine. Activities such as Tai Chi, yoga adapted for seniors, dance, or even simple hand-eye coordination exercises can stimulate the neural pathways responsible for motor control, partially offsetting the challenges imposed by aging or Parkinson's disease. A study from the University of Washington showed that elderly people who practiced Tai Chi twice a week had 31% fewer coordination problems and 43% fewer falls over 6 months compared to sedentary older adults. Fourth strategy, maintain adequate levels of vitamin D and B12, two vitamins whose deficiency is common in the elderly and can significantly impair motor coordination. Unlike vitamins A and B6, where excess is a concern, deficiency is more common for D and B12. Vitamin D can be obtained through moderate sun exposure and the consumption of fatty fish, eggs, and fortified foods, while B12 is found primarily in animal foods such as meat, eggs, and dairy products. For vegans or people with impaired intestinal absorption, B12 supplementation is often necessary, but should be guided by a professional. Fifth strategy, consider adequate hydration as a fundamental part of your approach to maintaining motor coordination. Dehydration, even mild, can significantly impact brain function and coordination in the elderly. A University of California study showed that mildly dehydrated elderly individuals performed 28% worse on fine motor coordination tests compared to the same individuals adequately hydrated. Keep a water bottle nearby and establish regular times to drink water throughout the day. Sixth strategy. If you are currently taking supplements containing high doses of vitamins B6 or A, do not stop taking them abruptly. Consult your doctor about how to gradually reduce dosages to safe levels, carefully monitoring any changes in your symptoms throughout this process. For people with Parkinson's, this transition should be especially cautious and preferably supervised by a neurologist familiar with your specific condition. Remember that individual response varies greatly, and what constitutes an overdose for one person may be different for another, depending on factors such as body weight, kidney and liver function, concomitant medications, and genetic variations in the metabolism of these vitamins. For older adults and people with Parkinson's disease seeking to preserve their motor coordination and quality of life, being aware of the potential risks of excessive vitamin B6 and A supplementation represents an important but often overlooked step. As we have seen, these vitamins, essential in adequate amounts, can paradoxically compromise neurological function and aggravate Parkinson's symptoms when consumed in high doses through supplements. This does not mean adopting an anti-supplementation tolerant stance, but rather a more informed and cautious approach, especially after age 60, when nutritional needs and the body's response to nutrients change significantly. It is worth emphasizing that, for most older adults, including those with Parkinson's disease, a varied and balanced diet provides the necessary vitamins in forms and amounts that the body can adequately process. Supplementation should be reserved for cases of documented deficiencies, and preferably under medical supervision. The benefits of a more natural approach to nutrition go beyond avoiding the risks of excessive supplementation. Whole foods provide not only isolated vitamins, but a complex of phytochemicals, fiber, and nutrients that work synergistically, offering benefits that no supplement can fully replicate. For those already facing coordination challenges related to age or Parkinson's, small adjustments to their supplement routine can make a big difference in quality of life. Many patients report significant improvements in motor control, balance, and medication effectiveness after normalizing previously excessive levels of these vitamins. The human body, even aged or affected by Parkinson's, has a remarkable capacity for recovery when provided with the right conditions. As I always tell my patients, the neurology of aging is not a one-way path toward inevitable decline, but a dynamic process that responds positively to appropriate interventions, even in advanced age. If this video provided you with useful information, please consider sharing it with friends and family who are elderly or living with Parkinson's. Knowledge is power, especially when it comes to neurological health in old age. I'd also like to invite you to join our community here on the Beyond Parkinson's channel. By subscribing, you'll have access to new videos every week with practical, evidence-based strategies to protect your motor coordination and improve your quality of life. We cover topics ranging from brain-specific nutrition to exercises adapted for different levels of mobility, advances in treatments, and techniques to preserve independence for as long as possible. To subscribe, simply click the subscribe button below this video and the bell to be notified when we publish new content. Remember, the more informed you are, the better decisions you can make about your health. Small adjustments today, like avoiding these 2 vitamins in excessive doses, can make a big difference for your future. Our goal is to transform complex scientific information into practical, accessible guidance that you can implement in your daily life. Thank you for joining us today, and I hope to see you in our next video. Take good care of yourself, and remember, preserving motor coordination in old age is not a matter of luck, but of informed choices, and you have just taken an important step in that direction.